At Humana, when you tell us what you need and want, we hear you. To help you find the right plan for you, we'll begin with an overview of Medicare. Medicare is a health insurance program run by the federal government. It has 4 parts. Part A, which covers hospital stays. Part B, which covers medical needs like doctor visits. Part C, also called a Medicare Advantage plan, combines Parts A and B. Plus, it could give you other benefits. And finally, Part D, which covers most prescription drugs. Together, Part A and Part B are called Original Medicare. Step 1 is to enroll in Original Medicare, offered by the federal government. Step 2 is to explore additional coverage. You may want to enroll in a plan through a private company, or if you want to add additional coverage to Original Medicare, you have a few options. You could choose Part C, or Medicare Advantage plan. These plans give you all the benefits and coverage of Original Medicare. Our Medicare Advantage plans may also give you extra benefits, and some may include Part D drug coverage if you choose an MAPD plan. Humana also offers individual dental and vision plans, as well as combined dental, vision, and hearing plans. These can be purchased by Medicare Advantage enrollees wanting additional coverage. Our individual Medicare options can be added to your coverage. You could choose to add one or more of these options to Original Medicare: a standalone prescription drug plan, or PDP, for Part D coverage, or a Medicare supplement insurance plan to help pay for any out-of-pocket costs you may have with Original Medicare, or an individual dental and vision plan, or a combined dental, vision, and hearing plan to help ensure coverage for all of your healthcare needs. Now, we're going to explore one type of plan a little more closely: Medicare Advantage Health Maintenance Organization plans, or HMO plans. On an HMO plan, you'll choose an in-network primary care physician, or PCP, from our nationwide networks to manage your care. Then, you'll need your PCP's referral to see a specialist in most cases. You generally need to stay in the network for services covered by your plan. Some HMO plans are Medicare Advantage only. They are Part C plans, meaning they combine Parts A and B coverage and may have additional benefits, but they don't come with Part D prescription drug coverage. The Centers for Medicare and Medicaid Services prohibits adding a standalone prescription drug plan to a Medicare Advantage HMO plan, even if it doesn't include prescription drug coverage. So consider your needs as you choose a plan. You could also choose a Medicare Advantage prescription drug, or MAPD, HMO plan. MAPD plans combine Parts A, B, C, and D into one plan, giving you prescription drug coverage alongside additional benefits. If you're considering a plan that includes prescription drug coverage, there are a few important things to know. Most Medicare prescription drug plans have 3 stages. In the deductible stage, you pay all costs until the deductible is met. A deductible is the amount you pay for your medication costs before the plan pays its share. Deductible amounts and exclusions vary across plans. Some plans may exclude commonly used medications from the deductible phase. During the initial coverage stage, the plan pays its share of the cost of your covered prescription drugs, and you pay your share, your copayment, or a coinsurance. Both you and your insurance plan pay medication costs until your Part D out-of-pocket costs reach $2,000. You then enter the catastrophic coverage stage. During this stage, you pay nothing for the remainder of the calendar year. The plan is responsible for the full cost of your covered Part D prescription drugs. If you think you may need help paying for your prescriptions, ask your sales agent about Extra Help or the Low Income Subsidy Program. It is a government program that helps people who qualify pay for their prescription drug costs. It's also good to know that some prescriptions require step therapy. It means that even if a medication you take is included on your plan's drug list, you may need to try certain drugs first before moving to a more expensive drug. And last, prior authorization. It's a type of approval your doctor is required to get from your plan so they can prescribe certain medicines. Every Humana Medicare Advantage plan offers extra benefits, services, or tools. These may include dental, vision, or hearing coverage, or in-home healthcare or virtual visits. Find Care is a tool you can use to find a physician or other care provider near you. Care Highlight clinical quality and cost efficiency ratings can help you make more informed choices about your healthcare. Talk to your licensed sales agent about your specific healthcare needs, such as durable medical equipment or physical therapy, and to learn more about the benefits and services available in your market. If you have dental, vision, or hearing needs, talk to your licensed sales agent about what is covered in your Medicare Advantage plan. You may also want to discuss your options for individual dental and vision or combined dental, vision, and hearing plans. Now, let's cover when you can enroll. The first opportunity is your initial enrollment period, or IEP. This date depends on when you turn 65. Your IEP begins 3 months before and ends 3 months after your 65th birthday month. During this time, you may enroll in Part A, Part B, or both. You may also choose to enroll in Part C instead or add Part D. You are not required to enroll in Part D, but you may face a late enrollment penalty if you go 63 days or more without prescription drug coverage after you're eligible. You may pay an extra 1% of the average monthly premium for each month you delay enrollment. You can avoid the penalty with prescription drug coverage through Medicare or with creditable prescription drug coverage that is expected to pay at least as much as Medicare's standard prescription drug coverage, such as a Humana Part D prescription drug plan, an insurance plan from your employer, or VA healthcare coverage. October 1st through October 14th is your chance to begin reviewing plans for the annual election period. Use this time to compare plans so you'll be ready to enroll beginning on October 15th. You cannot enroll before the 15th. The next important enrollment period is the annual election period, or AEP, from October 15th to December 7th. During the AEP, you can enroll in a Medicare Advantage plan with or without prescription drug coverage, or a standalone prescription drug plan. If you already have a Medicare Advantage plan, you may enroll in another Medicare Advantage plan or return to Original Medicare during the Open Enrollment Period, or OEP. You may only make one change within the period. Certain life events may qualify you for a Special Enrollment Period, or SEP. These are times outside the other enrollment periods when you can enroll in, drop, or change your plan depending on your eligibility. Before you enroll, your sales agent will go over a few important documents. This includes your plan's drug list as well as the summary of benefits to help you understand the benefits, coverage, and rules for your new plan. They will also provide information on star ratings. These are ratings from the Centers for Medicare and Medicaid Services, which evaluates certain Medicare Advantage plans based on real members' experiences. Let your agent know if you'd like more information. If you want to know how to file a complaint or would like to see a full list of your plan's costs, benefits, and rules, you can consult your copy of the Evidence of Coverage. If you sign up for a Humana plan, we'll send your ID card in the mail. You can choose to receive other plan documents online through a secure digital account at MyHumana. Humana believes better care begins with listening. That's why your licensed sales agent is here to get to know you, your healthcare needs, goals, and more. They'll review the plan's networks, premiums, costs for prescription coverage, and benefits. Your agent's goal is to help you find the right plan for you.